Hello dear respected students, welcome to our therapy number 1 Department of Russian-Slavic University. Today I am giving the basic methods of patient examination. This is our first lecture. Content of our lecture includes subject and task of propedeutics of internal disease, principles of clinical examination of a patient. Also, we'll study case history, general examination of a healthy person. Our therapy number 1 department, located in Fujuka Street, based on city hospital number 1. What is propedeutics? Propedeutics from Greek translated is an introduction to any size. For example, propedeutics of internal disease, it means preliminary introductory course preceding a deeper study of the internal disease. Three basic aspects make a sense of professional medical activity. They are diagnosis, treatment, prophylaxis. On the third course level, we will pay attention about the diagnosis. We will study how put the diagnosis, how prove the diagnosis. Fourth and fifth course level take you further into the treatment and prophylaxis of diseases. What is diagnosis? From Greek diagnosis, translated as a medical report on the pathological state, pregnancy, disease, and cause of death. There are two types of diagnosis: syndromic diagnosis and nosological diagnosis. Syndromic diagnosis is isolation of the main and concomitant symptoms. Main goal of propedeutic therapy is putting and finding out syndromal diagnosis. Example, bronchial obstructive syndrome, when our bronchi become to be narrow, or myocardial injury syndrome, or arterial hypertension syndrome. Next type is nosological diagnosis, highlighting the leading and concomitant disease. For example, bronchial asthma or myocardial infarction or angina pectoris, they are nosological diagnosis. There are three types of diagnosis: main diagnosis, complication of the main diagnosis, and concomitant diagnosis. The main diagnosis, the syndrome or disease which at moment are the main ones determining the prognosis of life or causing death. And complication, of course, this complication are really pathogenetically related or caused by the underlying disease. Example, bronchial asthma may have complication as respiratory failure, and concomitant diagnosis as syndrome or disease that are not pathogenetically associated with the underlying disease. For example, bronchial asthma, this is main diagnosis. Respiratory failure, this complication of main diagnosis. And concomitant diagnosis is arterial hypertension or maybe myocardial infarction. They are not related with each other. There are two concepts, symptom and syndrome. Very important concept is symptom. Symptom is sign of disease or appearance of disease. There are two types of symptom: subjective symptom or objective symptom. Objective symptom detected by physician. Subjective symptom. Example, for example, is headache or chest pain. Physician couldn't detect or couldn't see patient's headache, couldn't see patient's chest pain. Objective symptom like edema or rash or for example increasing blood pressure, this is objective symptoms. What is syndrome? Syndrome, the set of symptoms which based on common pathogenesis, which based on common mechanisms of development. Examples of syndrome: bronchial obstructive syndrome, as you mentioned before, or maybe consolidation of lung tissue syndrome, or bronchial ectasis syndrome, or maybe hyperairness of lung tissue syndrome, and etc. To differentiate what is syndrome, what is disease and symptoms, I made for you this graph, and this graph demonstrates you disease, and as you see here, each disease can contain different kind of syndromes, and each syndrome consists of symptoms. Example: bronchial asthma, this is disease. Inside the bronchial asthma, we have different kind of syndromes, like bronchial obstructive syndrome, when our bronchi become too narrow because of allergic process. Also, bronchial asthma has allergy syndrome. Also, bronchial asthma has respiratory failure syndrome. But this bronchial obstructive syndrome, which has different symptoms like cough, dyspnea, chest tightness, which grown by one mechanisms, may be part of different kind of disorders. For example, bronchial obstructive syndrome may be part of COPD with other syndromes, or bronchial obstructive syndrome may be part of heart failure, congestive heart failure, or bronchial obstructive syndrome may develop because of suppressing by enlarged chest lymph nodes, and etc. That's why bronchial asthma, this is disease, may consist of different syndromes, and each syndromes contain different kind of symptoms or set of symptoms. During our interaction with patient, we should always keep the morals and ethics, set of rules, medical ethics, medical deontology is set of rules which govern our behavior during interaction with our patient, and always we should pay attention about our behavior during interaction with patient. An occasional thoughtless word from the physician may impair the mood of patient, may impair his sleep, appetite, and general condition, even may provoke the disease. Not only occasional thoughtless word, even occasional wrong prescription of physician may provoke disease. These disorders which provoked by occasional prescription of doctor, because of doctor or because of physician, we call it as iatrogenic disease, iatrogenic diseases. And during our interaction, always we should keep medical secrecy, Case history is a main document, medical document, which contains data about the progress of the disease from early manifestation till the present moment. The survey based on data of subjective and objective tests, main documents, and today we will study how interview the patient and which parameters we should put into this case history document. There are clinical steps of clinical approach. Of course, collecting the history of disease of patient, do examination, provide the investigation, and of course, last is management. There are two diagnostic methods, main and additional or accessory diagnostic methods. Main diagnostic methods include subjective and objective. And as you mentioned before, today we will focus on subjective methods, inquiry, analysis of taking history. Objective methods includes inspection, palpation, percussion, and auscultation. And after providing objective methods, we should prescribe the patient any lab test or instrumental tests, sometimes genetical and experimental tests. What is palpation? Palpation as examination methods when you are, by touching the patient organs, take information about these organs. You can palpate the heart region, you can palpate lung region, you can palpate chest, you can palpate the abdominal region organs like liver, like spleen, and parts of GIT. Percussion. Physician striking, and during striking different organs give you different sounds, and during percussion you are recognizing sounds which produced in any kinds of organs. For example, if you percut the cardiac region, it will give you cardiac dullness. If you percut the muscles, it will be flat sound. If you percut the lungs, it will be resonant sound. Stomach and abdominal region give us timpani sound. These 4 to 5 weeks we will study healthy organism. After that, we will go further into the examination of respiratory disorders. Sometimes, instead of resonant sound, you can percut the dull sound. It will be in pathological condition, for example, in pneumonia condition. Sometimes, instead of resonant sound, you will percut timpani sound. This timpani sound, instead of resonant sound, can formated due to abscess formation, lung abscess formation. Auscultation also is very important examination. To auscultation we use equipment like stethoscope, and you can auscultate the valvular disorders, you can auscultate heart valves, you can auscultate breathing sounds, you can auscultate abdominal region, you can take information about the functioning of viscera and vessels. Okay, let's go to the history taking. History taking is very important, and it should collect it very attentively. Hampton said that history taking was responsible for 82.5% of all diagnoses. There are parts of history taking or inquiry of patient or anamnesis. Latin name of inquiry is anamnesis. There are 4 types, 4 steps. First is passport part, pars officials, and patient complaints. History of the present illness, Latin name is anamnesis morbid, and life history, Latin name is anamnesis vitae. Of course, before asking patient about his passport part, you have to introduce yourself. First, who are you, on which position you are working. For example, hello, I am a 3rd course student of general medicine department. My name is Harshita, for example, and then you start collecting passport part of patient. Passport part includes patient's name, his age, his sex, his residence, his phone, workplace, profession, position, time, and type of admission. And then you are going into the patient's complaints. Patient complaints, there are 3 types: main complaints, additional complaints, and general complaints. Each complaint needs to be detailed. What is main complaints? For example, main complaints for pneumonia, this is cough and increase in temperature. Main complaints for bronchitis, this is cough. Main complaints for angina pectoris, this is chest pain. Main complaint for arterial hypertension, this is headache. Additional complaint. For example, your patient has pneumonia, he has main complaint is a cough with production of sputum, and also he has constipation, which is not related with each other. It is that will be additional complaints. General complaints. Mostly general complaints represent of intoxication syndrome. This is malaise, weakness, insomnia, headache, decreased appetite. These general complaints may be present in many kind of disorders. For example, malaise, decreased appetite, weakness may present in flu, may present in myocardial infarction, may present in gastritis or in enterocolitis, and etc. Each complaint should be again detailed. How you make detailization of complaints? Of course, you should ask about the site. For example, pain, chest pain. You should ask site, where? This is local pain or diffuse. Onset, it was rapid or gradual, or maybe a pattern, and where is worse, where is better. Character of pain, for example, vertigo pain, or sharp pain, or stabbing pain, or burning pain, for example. For myocardial infarction, character, stabbing and sharp pain. For angina, for example, character, burning pain. Radiation, where eradicate this pain, for example, eradicate to the left arm, to backside, to abdominal region. Elevating factors, time course, exacerbating factor, for example, this pain occurred during physical or emotional overloading. Severity of pain from 1 to 10, for example, mild pain or very severe pain. Associated symptoms, for example, pain may be associated associated with dyspnea, or headache may be associated with high fever, and etc. And you should also ask, does it interrupt life or not? If you are asking about pain, for example, here we have patient with chest pain, you should ask about exact site or location of pain, nature of pain, onset of pain, severity, and duration of pain. For example, several seconds or 5 to 10 minutes, character for angina pectoris. More than 1 hour, character for myocardial infarction. And also here we have different kinds of symptoms which character for different organs, systems. Cardiovascular system includes the chest pain, breathlessness, palpitation, edema. For example, digestive system has specific symptoms like decrease or increase appetite, thirst, difficulties of swallowing, nausea, vomiting, epigastric pain. For example, urinary system has also specific symptoms like pain, urination, and changing of urine character, and etc. After collecting the complaints and detailization of each complaints, main complaints, additional and general complaints, you are going further to collect the anamnesis morbid or history of the present disease. During collecting this part, you should pay attention about the time of the onset of disease, the character of the first symptoms, course of the disease, examination and their result, if any, treatment, if any, and its efficacy. During collecting history of present disease, you should ask about the onset of disease from the beginning. This is history from the beginning of disease till present moment. For example, here I drew for you acute bronchitis anamnesis morbid. At the beginning, patient has fever, and then in 1 day added sore throat and dry cough, and then he went to doctor and doctor prescribed paracetamol, and then in 5th day decreased appetite, weakness, and after 1 week added moist cough. This dry cough changed into the moist cough, and patient went to give analysis like blood test, which shows increased leukocytes level, increased ESR and C-reactive protein, and also was examined by chest X-ray, which